Hello, good morning, everybody. Okay, we'll be talking about something so interesting. We'll be talking about IUI at home. Intra-uterine insemination you can actually do at home. Wow, it seems strange, but this is another method you have to do, and you know you've gotten what you wanted. All right, but before then, before you be able to get it right, as I'm teaching, you must know how to do it. You must know how to reasons why you should do it, and at the same time you must understand that there are certain obstacles that can actually be on the way and hinder that very process you want to take up, since you've been trying several methods. All right, there are certain inhibitions you might get along the side, obstacles that you can actually perceive or you actually see that later on you see that what you did not work. So in order to avoid it, you have to learn this. You have to learn to know that for you to be able to get this IUI at home, to be able to get this very baby direct to your womb. Do you understand? And fertilization takes place even if the sperm cells of your husband, which is predisposing factor, is a bit low, or even if the motility is a bit dull. All right, let's go ahead. For you to be able to get this at home, you have to do certain practical things. One, you have to make sure the PID and every other blockage in the system is detoxified. What do I mean? If you have PID in the house, I've actually treated PID. Make sure that you've already treated yourself of PID, pelvic inflammatory disease. Make sure you've treated yourself of any UTI, urinary tract infection. Make sure you've already treated yourself. Make sure you go to the lab. Make sure you diagnose yourself. Make sure you request for urine culture. Make sure your husband's as well request for urine culture, and then semen analysis. All right, being able to identify this and being able to get the right antibiotics, the sensitivity done. Antibiotics will be prescribed for you, and once it's done, make sure you do your treatment properly. Remember, we are talking on how you can do IUI at home. What do I mean? You want to get those insemination because of the cost on your own at home. All right, how do we do it naturally? Okay, look at what you do. You treat yourself. The treatment might actually take for 10 days, and after taking your treatment, either the tablets alongside with the injections, after you treated yourself through the nurses that will be injecting you, now what do? You go back to the laboratory and then redo the test. At least after 1 week you've done that same treatment, 7 days, so that the drugs in your system will actually detoxify. Do you understand? The drugs must have actually left the system. Make sure that at the point you stop taking the treatment, you're done with it. Continue taking more of your water to detoxify your system more. After you've been able to do that, at least for the 7th day, 7 days, the 7th day you return back to the lab. And at this period, make sure you're not meeting with your husband. Even if you have, just make sure that he's releasing outside. All right, so what we would do again, but I would prefer you don't meet at all. So after that 7 days, you go back to the laboratory, and then the semen culture will be done again, and your urine culture and HVS, high vaginal smear, will be collected again and be done again. Whatever comes out of it, if it's scanty or not, you still make sure you clear yourself. All right, so after doing that, after you must have done those treatments, all right, and doing the right diagnosis again, the next thing you should go ahead and do is, now you should be able to increase your intake of those vegetables that is actually so nutritious for your fertility to increase. What do I mean? You have to increase, your tiger nuts. You'll be able to get your tiger nuts, soak them after you must have washed and removed the dried ones from it, the ones that are spoiled. You'll be able to dry it for 24 hours. After you've done it 24 hours, you wash again and soak again for another 24 hours. After you soak it, making it 48 hours soaking, then you get it and blend it with your blender. So when you blend with your blender, you add your ginger to it. The ginger quantity will be at small depending on the quantity you're doing. If you're doing one penta dried tiger nut, you're going with 1 big stick of your ginger, so you'll be able to increase the antibiotic effect there too, and the spicing you're doing through that same ginger, it will help you. Then inflammation that is in the system in one way or the other, it will still help to clear and increase the blood circulation. So when you've done this, the next thing you do, you started taking it, you started increasing your banana intake, your carrot intake with your husband. As you're doing this, your husband is equally doing that. Make sure that after you've grinded that, your ginger and your garlic, you'll be able to sieve it, and then use about 1 Eva water to 2 Eva water to that same 2 Eva water to the 1 penta of your 1 penta of your ginger. When you do it, you put it in the can, measurable can. I will be showing you that. Once you put it there, you'll be taking it at least a glass cup every morning. First thing on an empty stomach, you actually have to do that. So before you take it, make sure you take about 1 glass cup of your warm water. Once you do 1 glass cup of your warm water, you give it about 30 minutes again. You take your ginger, you take your tiger nut milk. As you're taking, your husband is equally taking, and then you leave for work. As you take it, and once it's about 11 o'clock to 12 o'clock, then the next thing you have to do is to take your normal meal of your choice. Once you do it, between that time you've taken your lunch, what you needed to do is to increase your intake of fruits. You can actually take your swallow depending on what you choose to do. You can actually take any meal you feel like. Then make sure you increase your intake of vegetables, your apple, you take your bananas, you take your carrot, you take your watermelon, you take your cherries, you take your berries, and the rest of it. Make sure you dash out with all those things. Make sure you dash out to the ShopRites around you, the grocery shops, the shops, and pick up those fruits and get it ready. I'll be showing you those of your fruits you need. And then as you're doing it, you practice it for complete 1 month or complete 6 weeks. As you do it for complete 6 weeks, the next thing you have to do is prepare your mind. And remember, as you're doing this, you're not making love with your husband. These are practical measures you can actually take and then be able to achieve your IUI at home. All right, what do we do? After the 6 months, 6 weeks, you're already taking those fruits. What you need to do is to continue you start from that 6 weeks to start making love to your husband. But before you start making love to your husband, you have to remember your tracking procedures. You have to remember what your menses is saying. You have to know how to track your ovulation. You've been able to get your ovulation. So the menses you're going to see at that very month, on the 5th day, you have to add up on that 5th day. Instead of taking your Clomid, instead of taking those hormonal booster you're to take, you have to do it naturally. You have to take 1 egg. Take your 1 egg, 1 stick of your banana, and then 1 tin of liquid milk. Mix it together. As you blend it, you take it. All right, as you're taking it on that 5th day, you equally give your husband. Your husband will take his own. So 1 stick goes to you, 1 stick goes to your husband, and 1 tin milk goes to you. Just the same to your husband, you take it. So tracking your ovulation from the 5th day of your menses. All right, you take it. So on the very day of your ovulation, what you need to do is to take it. On the very day of your ovulation, you see the slippery eggs coming out, even if it's the early pap and the rest of it, you start making love to your husband. If you decide to make it on that very peak, for a reason of a boy child, then you have to make love to your husband. At the point he wants to ejaculate, as he's ready to ejaculate, you do as if you want to urinate. At that point, the wombs open up. Once it opens up, you see yourself. The egg, the release of sperm cells go directly to the uterus. Thank you. As we continue. All right. So as he wants to ejaculate, as I said. All right, what you needed to do is to get yourself ready. But before making love to your husband, you've already had your bath. Obviously, clear your system, wash your vagina well. Then your husband equally will wash himself to avoid any slight infection. Do you understand? But make sure you're not using any soap. You're using water directly to wash your vagina. As once you've done it, all right, so you're ready. So already the karas and the rest of it will go on just to stimulate your hormone. Some of my patients do dancing. You know that dancing has a way of stimulating your mood. So you can actually do your dancing as well. Once you do your dancing before the act, you make sure you're happy. You can actually put musics around you. You can actually, anything that you think that can actually trigger your mood and make you come up and get balanced, so that as your husband is actually coming up, you're making out with your husband, you make sure that you yourself is coming up. You're so relaxed. You're not thinking of what is on the fire. You're not thinking of anything. You're as fit as everybody. You're focused so 100%. You're so happy. And at that point, as he's giving you, you're actually communicating as well. You're doing yours. And what else you needed to do at that point? As your husband has come to the level of ejaculation, what you needed to do, remember as we had bath, that obviously there is no remnant of urine in the bladder. You make sure it's so empty. So at that point, when you're making love with your husband, what happens next is you see your husband already as he wants to ejaculate. You have a pressure in your uterus. You pressure as if you want to open the bladder for urine. As you're doing that, you're opening the uterus on your own, and the sperm, as you're releasing, make sure you hold on to that very uterus you open, that is open, the mouth is open, the head is open. As it's ejaculating inside your uterus, as it's ejaculating in there, you see the drop of those sperm cells will go directly to that opening that you have. In so doing, the sperm has its movement directly without the tissues that is in the vagina, in the walls of the vagina, being a blockage somehow for those who their sperm cells is a bit weak. So doing this and practicing it all the time is what enables the penetration of those sperm cells quick to the ovaries through the fallopian tubes, direct to the ovaries, and you see fertilization takes place. So now we are combining factors of knowing your cycle, being able to track it, being able to track your ovulation, being able to clear your bladders of urine, being able to enrich yourself with vitamins. And this is what you do. The insemination is what you do by opening up your uterus as if you want to urinate, and hold it as somebody that have pressure of pushing urine out. You hold it immediately he wants to ejaculate. You hold on until he's done with the ejaculation and comes out. A little while you can close up. You see yourself, you see that very month will be a miracle month for you, and this fertilization will seek for will completely come, and you will thank me later. Don't forget to subscribe. If you've not started following me in my Facebook, in my Instagram and YouTube, continue to follow me, because you continue to have this very information that will help you, help your neighbors, help your sisters, and you'll continue to thank me later. Thank you. As we continue, don't forget to subscribe to my YouTube channels. It will equally encourage me and then give you a satisfactory information that will help you later. Thank you so much.